That's right. We can go ahead and get started.
Okay. And just in case I lose track of time, can someone remind me when Dr. Himmelfarb is going to be starting? Is it at 11?
It's at 11.
Okay. Well, great. Well, Janet and Michaela, thank you so much for joining us. There may be a few other people participating in our panel. This is a group of residents in the internal medicine program who are training.
How do I take off this? Excuse me. How do I take off this? I don't see you because there's the meeting is being recorded by the host participant. There's
Oh yeah,
what do you call it?
I think you just have to click that it's okay with you. Are you able to click on that button that says it's okay for us to record?
There's I don't see my okay. I don't know where to push that record. I don't know. It doesn't say anything. Oh, okay. Sorry.
Well, now we lost you, Michaela. We can't see you.
Yeah, okay.
Hear you. There you go. Oh.
Oops. I don't know.
Well, we can see you and hear
that's
you,
it. Okay.
which is great for us. You good now?
Mm-hmm.
Okay, awesome. So thank you both for being here. My name's Carrie. I'm gonna try to talk as little as possible. And I was hoping that we could just start by having you guys introduce yourselves to us. Like I said, this is a group of residents in our internal medicine program, and maybe some of them are going to be nephrologists, but most of them aren't. And so this is our opportunity to learn from you about your experience as folks who do dialysis at home. And so perhaps, Michaela, since we were just talking, can you start by just introducing yourself to us and telling us a little bit about you independent of dialysis, just, what's important in your life, and then we'll come to the dialysis part of it.
Okay, as a backgrounder, I am a musician. I play for a long time before in the Philippines and Philippine Philharmonic Orchestra for 31 years before I came here. And as also a backgrounder, I was diagnosed with kidney disease since I was 26 years old. So, and then I had dialysis for 1 year there, peritoneal, and then I had a transplant, and a very good transplant, about 25 years with no illness, and I had a very good life with my transplant. But I got, what do you call this? After 25 years, I got breast cancer, and so I went back to dialysis. So that's the background.
Thank you so much. And how long have you been back on dialysis now?
6 years.
6 years. Okay. Okay, thanks. And Janet, tell us a little bit about yourself.
Oh, I'm retired. I became diabetic in about 1998. And I think that that's ultimately why I ended up with kidney disease. And then 2 years ago, through a number of circumstances, I was connected up with Dr. Hall at Harborview, and he's been taking care of me ever since. I've been on dialysis now for 2 years, and when my daughter and I went to a class about dialysis, we had no idea that there was even home dialysis at all. All we'd ever heard about was going to clinics. And when we found out about the home dialysis, we looked at each other and nodded, yep, this is a way to go. And I agree. For the time being, it's a great way to go.
Well, maybe I can just kind of dig down on that for a second. So where was the class that you took? Was that something at Dr. Hall's office, or was that elsewhere?
It was moderated by Northwest Kidney Centers, and it was at Harborview on the same floor as Dr. Hall.
Okay. Okay. And I want to come back to what it was that about peritoneal dialysis that made you think, yeah, this is for me. Michaela, what was your experience in learning about dialysis? I guess the first time was many years ago, but can you remember who kind of walked you through that? Where did you first learn about dialysis and learn that you can do dialysis at home?
With the home, I just learned it here. In the Philippines, we always do it in what do you call this? In the hospital, but because it's peritoneal, so we can also do it manually at home, manually, not the machine. But when I reached here, so at first I was on manual, and then they introduced me to this what they call this home choice machine. That's an old machine that's the one we're using right now. So home choice. So I said, oh, that's good. I can do it once a day, because when you do manually, you do it every 6 hours. But if you do it with a machine like me, I do it in the evening. I start prepping the machine at around 8:30 in the evening. And then when it's all prepped, you have just to get sleep. You know, it's the machine that does everything. It's 9 hours. So, and then in the morning, you just like disengage from the machine. So,
And Janet, I see you nodding. Is that your experience too?
Yeah, when we first heard about it, they were saying it would be 9 hours at night. And I said, oh my gosh, takes that long. And then as I got going with it, I realized, like Michaela, I just hook up to the machine. I go to sleep. When I wake up in the morning, 9 hours later, I may not be may not be 9 hours. I'm fortunate to have a good 4 hours of sleep. And then I wake up and read a while or whatever, and then go back to sleep. But I usually determine, okay, what do I have to do in the morning? And that determines when I hook up to my machine at night. And so I'm usually hooked up about 10 o'clock at night.
Got it. So you kind of calculate backwards based on what your morning's going to look like.
Yes.
And then are your days free, or do you find that you're having to do dialysis stuff during the day?
I do a manual dialysis in the middle of the afternoon. I have 2 alarms on my phone. One for me to turn the heating pad on at 1:15. The second one is at 3 o'clock when I start usually my manual dialysis. And then when that's done, I go about whatever I'm going to do after that.
Great. I'm going to open it up to the residents in just a minute. I have a couple last questions that I'm interested in knowing, and then we'll see what our residents want to learn from you all. So one of my questions is going back to one of the things you said at the beginning, Janet. When you heard about doing dialysis at home, you said, this is for me. What was it about that felt like was the right fit for you, as opposed to doing dialysis in a dialysis center? And then Michaela, I'm going to ask you the same question.
The fact that I could do it at night, I had my days free. I didn't have to go into a clinic every other day and feel like crap all the time, because that's one thing that they did mention, that in the clinics, people usually come in, they are not feeling well. And I wanted to start feeling better. And I did feel pretty bad for a while. How much of it was my kidney disease, how much of it was who knows what, I don't know. But on the whole, I'm feeling great now.
That's wonderful. That's what we like to hear. And how about you, Michaela? What was it about doing dialysis at home that felt like the right fit for you?
okay. For me, it's an advantage because, going to although I live very near kidney center, I don't like going to the hospital. That's number one. So at the same time, I can do more activity because I don't do manuals. I only do the machine in the evening. So that's just 8:30 to around 7 or 6:30 in the morning. Then I'm done. So that means the whole day I'm free. Like I can go out if I want to, if I feel well, and then I do a lot of activities. Like I do the groceries sometimes, and then I think it's better if it's at home because you have control of your time. So I guess that's all. And then also the checkup I have is every 2 weeks. So I number one, I don't really want to go to the hospital. So that's an advantage.
Yeah, I get it. That makes sense. And then my last question before opening it up to other folks is, like I said, some of the residents that are here today might go on to become kidney doctors, but most won't. And you guys see kidney doctors, but also other doctors, right, who aren't kidney doctors. My question is, what do you wish your other doctors knew about your life as someone who does dialysis that you find they don't know, or that you have to teach them? What do you wish your other doctors knew about you being someone who does dialysis?
For me, okay. I hope there will be, some research that we will no longer, when you have a kidney disease, you no longer go under dialysis. Although this one is convenient and it helps you do your activities, dialysis is still dialysis. It's still difficult. So, but you still have to bear with it. At the same time, it gives you it helps me in having a better life. I mean, I'm not sick that all the time. I'm not weak. And maybe because the doctors are also taking care of me. Like, of course, they take the other things that are also needed, like my heart and the other organs. At the same time, I hope there will be some, just medication to take for the kidney, like a pill, that we don't need to do dialysis. That's my wish. Or, of course, looking forward to a transplant. But, if it's better, if no transplant, that my kidneys will work with medication only.
We would love that. And what about you, Janet? What do you wish your other doctors would know about dialysis that they might not know?
Well, I guess I've been fortunate when I have mentioned that I'm on dialysis, peritoneal dialysis. My doctors have all, yes, apparently they know about it. I have a diabetes doctor, my regular primary doctor, whom I don't see very often because I see Dr. Hall all the time. But the doctors that I do go to, they all seem to know about it, especially the ones at Harborview.
That's great.
But I think it is something that more doctors should know about so that they can guide their patients into an area where it might be better for them. And I realize that some people, yeah, it sounds great, but then they find out they really can't. They don't have the strength to move the bags of solution, or they don't have this or that. And those 6-liter bags can get pretty heavy.
For sure. Yeah. Okay, well, let's open it up for questions from, I could ask you questions all day, but from our residents. I'm gonna have the chat, I have the chat open, and you can also use the raise hand function, and I'll try to keep an eye out and see what hands are raised, and I can just call on you. Does anyone have questions for Michaela and Janet? Looks like Ruth has a question. I'm not sure how to put your hand down, Ruth, but I'll so feel free to unmute yourself and ask your question.
Okay, I think I can lower the hand. But first of all, thank you both so much for talking with us. This is really valuable, and it's we are taking up some of the time that you've got. So I have one question for Michaela first, which is which instrument you play, and then I have a second question for both of you as well.
All right. I play the double bass, the string bass, the big one.
Okay.
And I play the piano too. But regularly now I have a job. I play music at the church in Immaculate Conception. That's every second and fourth Sunday. But every Friday we do rehearse with the choir. I am a choir director. So that's basically my job. And well, it's part-time because I'm more of my schedules with the medical schedule.
Okay. Yeah, I was wondering how much this has changed what you can do, and professionally, if you're a singer, for example, peritoneal dialysis might actually impact what you can do.
Actually, I can still play. I'm still connected with an orchestra here, but I don't regularly play because there are times when maybe because of dialysis, my joints are painful and things like that. So how do I say? Before I can do everything in 2 hours, like physically, but now I'm limited because there are times when I get tired right away, maybe because of dialysis. So, I need the strength. But there are times when, for example, the schedule is very light and the music's light. So then I join them. But that's not regular. So, I mean, in the double bass because it's a big instrument. But my doctor, Dr. Shannon, I think he plays the cello. And one thing, every time we see each other, it's not he said. Well, he asked me how I am, but the first thing he asked, "Did you practice?" He wants me to practice because he said, practice is also making you giving strength. That's number one. At the same time, so that I'll enjoy. So that's number one question he asked. He doesn't ask about kidney later on, yes, about kidneys and everything like that. But he first asked me if I practice my double bass.
Okay, thank you. And that kind of leads into the second question as well for both of you, which is, there, as you said, there are upsides and there are downsides to doing any type of dialysis. And have you ever experienced any infections or complications from the peritoneal dialysis?
No, thank God. No.
Yes, I was in the hospital in May for about 6 days with a peritoneal infection. The first night that I was there, the machine didn't want to process the dialysis because they said that there was so much infection. And so I kept having to hit the reset button. But after that first night, which took forever, like 15 hours, 16 hours just to do the first drain, things got better. The other thing was the food was lousy. And there've been other times when I've been in the hospital, not for this, and it was pretty good. But the kidney diet that they have in the hospital is terrible.
Yep, I've definitely heard that before. I'm sure all of our residents have as well. I see
when I talked to my dietitian, he said that the diets that they have in the hospital for kidney patients is for patients who have dialysis in the clinics and that sort of thing. It's not for peritoneal dialysis.
Yeah, there are some important differences. That's true, especially as it relates to potassium. Yeah.
And I think it's something that needs to be considered because in those 6 days, I ate minimally because I just couldn't get it down.
Yeah, that's really helpful feedback. I'm going to pause just a second. I see that Kim asked a question in the chat, but it looks like Musu was able to join us. And so, Javel, if you could perhaps pin Musu when she's speaking, her username is showing up as Samsung. Musu, I'm Carrie, and I was wondering if you could just introduce yourself to us, and thank you so much for joining. Oh, you're muted. There
Is
you are.
out?
Yeah, now we can hear you. Yes.
Hi, my name is Musu and last name Drame. I am in PD for 5 years now.
5 years.
Yeah.
Well, thank you for joining us. We've heard a little bit about Michaela and Janet's experience with PD. Maybe I can ask you the same question that I asked both of them, and that is, when you learned about PD, what was the thing that made you say, yeah, that's the thing for me, not going into the center, but what was the thing about PD for you?
To have your own freedom. You can do it anytime you want and anytime you want to go to bed. You can do it and you can go take it out and go and do your stuff. Anytime you come back, then you can put it out again.
Yeah.
So it's a freedom.
I think we heard that same thing from both Michaela and Janet. So thank you. And maybe I'll start with you with our next question, which Kim asked in the chat, and that is, are you able to do the PD exchanges and all of the stuff by yourself, or do you have someone at home that lives with you that helps you and assists you?
Sometimes when it's alarm, I call my brother, but I do everything for myself. Only the boxes, he's the one who helped me for that.
To lift the boxes. Yeah, we heard from Janet that they can be heavy.
Yeah, because the waters, they are very heavy.
Yeah. How often do boxes get delivered?
Every month, once a month, every month.
Once a month, every month. And how much space do they take up? Do they take up a lot of space?
No, because I have an empty room where I put them there.
You have a room where the stuff goes. Okay.
Yeah.
And Michaela, how about you? Do you have someone who assists you, or do you find that you do the PD by yourself?
I do the PD by myself, but my mom helps me in carrying the bags. Like, because we live in an apartment and I have a storage. The storage is just about maybe one door apart from my room, and then so she picks up all the necessary things that I need to, like the 2 bags and one. I use 3 bags actually, 2.5 and 1.5. That's the ICOD Extreme. So I use 3 bags per night, and then so she helps me in, putting the bags and taking the bags. But everything, connecting the machine, everything, I do it myself.
And I see you nodding, Janet. Is that your experience as well?
Yes, I do everything for myself, and I've already decided in my mind, okay, I really can't haul that drain bag from my room to the bathroom and to dump it. I'm going to start using an open line, and I figured out how I can do that. When I can no longer handle the big 6-liter bags, then I will determine, okay, I've got to start going to into the clinic. But that's way down the road. As long as I can do everything for myself, I'm going to.
Great. What other questions do our residents have? I see a hand up from Nicholas.
Hi there. Thank you guys again for speaking with us. And I'm sorry I can't have my video on this morning. I'm one of the 3rd-year residents. I just wanted to ask a question broadly to everyone. You all sound like you're quite experienced and really experts at doing this for yourself. But I'm curious about when you were first starting, what were the things that were hardest to learn as you were going along, looking in hindsight now that you're so experienced with it?
For me, the first 2 weeks that I was on dialysis, it was all manual. And it just drove me crazy because I could barely be done and I had to start setting up for the next time around. And so when I finally went into the clinic to start learning how to do the dialysis on the machine, it was a big relief to not be so tied to a manual dialysis regime.
Okay, about me, in comparison to hemodialysis, I guess I would like to stay with peritoneal because I think it's more painful. I don't know. Well, I haven't undergone hemodialysis, but I don't think I can do that. The first thing that just really bothered me when they informed me that I have kidney disease was doing dialysis. If you don't know what dialysis is all about, it will be very frustrating and devastating, like the end of the world already knew. But when my doctor informed me that this is how it works, then I was enlightened and I said, okay, then it's not the end of the world. And then you can still have, as what they told us, I mean, the other patients, yeah, it's freedom. So it's just, at first, it's really difficult. But as you get along, it's a better way than hemo. That's what, well, I haven't done hemo, but I think we're better off than them. That's how I look at it.
And Musu, can you remember back to when you did your training? Did you train with manuals first?
Yeah, I trained with my brother. We go together, but he was the first one who can know it more than me. He is the one who used to help me for everything for 2 weeks. Then after that one, I can do it for myself. And it is a freedom for me to do it. And my doctor called me, before I do it, even my doctor called me and told me that you have to do dialysis, but there is 2 ways to do it. Then he recommend me to do the PD is better than the other one. So I went for it. Since then, I'm so happy with it. I never have anything like sick or anything. Sometimes I'm sick, I throw up, but it's not too much.
And so it sounds like you feel better on dialysis than you felt before you started dialysis?
Yeah.
Good. What other questions do people have?
My brother is the one who is the caregiver for me. If you want, I can give it to him. You guys talk to him too.
Is your brother there with you? We'd love if he joined.
Yes, yes. He's there, he's here.
And what's your brother's name?
Lamin.
My name is Lamin.
Hi, Lamin.
Yeah, hi.
Thank you for joining us.
Yeah, thank you so much for the program.
Yeah, I'm gonna see if our residents have any other questions for the panel. But we just want to say thank you, Lamin, for helping to make dialysis at home possible for Musu.
Yeah, the thing is, in terms of the PD dialysis, as she keeps saying, when it was first introduced to her, based on as the first patient has said, if you heard of a dialysis, when the doctor told her, well, I have to put you for a dialysis, we both look at each other. She was kind of thinking, oh, maybe this is the end of my world. And then because doing the chemodialysis, which we don't want that to be done. And then the doctor told her, well, there are 2 types of ways. There is a peritoneal dialysis and the chemodialysis, but I would like you to try the peritoneal one, which he said, I think it's easier and more convenience, more time for yourself and things like that. And then she looked at me, I said, well, let's try that. I don't know what kind of a dialysis it is. Then when he put her onto it, we went on classes, and then they tried to show her how things are done. After she have done that, she has been very, very improved based on the PD. And then I'm so pleased with it because I have seen a lot. I know her very much. There were a lot of things that used to happen before doing the PD dialysis. And now she is much better. She used to have a weight, and now she lose the weight. She's on the transplant. So there's a lot on Musu's side during this PD. So I was so pleased about it.
We love to hear that because we only get to see, you know, our patients ever so often, but you see her every day. And so your perspective is so important.
Yeah, because we live together. He's in the other room, I'm in the other, but, you know, and I have seen a lot, you know, after when she did this PD dialysis. It's very important. It is. I would even rather encourage a lot of people, if they want to do dialysis, to go on for the PD. Because for me, I don't know anything on dialysis. I don't know anything on the chemo or the peritoneal. But based on what I heard from other people, what they talk about the chemodialysis is way different with the peritoneal. Being doing that, she's been doing that for now almost 5 years now. So I'm so pleased with that. I will recommend that to anyone who want to go for a dialysis.
Okay, if I have any of my patients' caregivers are concerned about it, I'm going to give them your name and phone number. Okay.
Sure. Yeah, that would be great. I can talk to them because I have learned a lot. I went with her on a lot of, you know, classes, you know, based on how, you know, to do the dialysis and, you know, the diabetic itself, you know, because I'm with her always. I'm the one who transport her for appointments. So I have, me personally, myself, I have learned a lot, both on dialysis and the diabetic. So if anyone have it, I don't pray for it, but I would recommend anyone who wants to do a dialysis, let them try a PD1 because it's more convenience.
Thank you so much for sharing that. I think we probably have time for one more question. Do any of our residents have questions for our panel?
Okay. Do you have any questions for the panel?
And if not, maybe I'll ask one last question, and that is, if you could change one thing about peritoneal dialysis, one thing that you don't like about it, what would you change?
Oh, the water is too heavy.
The heavy bags.
Yeah, if my brother is not here, I cannot do it.
Yeah.
To put it up, yeah, it's very heavy.
Janet or Michaela, anything that you would change about peritoneal dialysis if you were all powerful and could change it?
No, right now I think it's okay. I mean, I'm using a lighter one, like 5 liters only. Usually it's 6 liters. So if you use the 5 liters, it's lighter. And then I also, well, you have to always be on top of your, like, for example, you have to know, for example, at the first, you know, my machine was not really that working well. So I have so many questions because I have a background in engineering. So if the machine has not functioning well, so I have questions like liters and things like that. So, you know, volume and things like that. Because sometimes I said, why is it feeling more than I need? So I tell the nurse, and then I call Baxter for some problems. And one time it didn't drain because of, for example, when you change from 6 liters to 5 liters, sometimes the machine will not accept it and then it will not drain. So if I call Baxter said, let's turn it off because it's a computer. So turn it off. And then after about a minute, we turn it on and then it functioned well. So I think it's also, you know, it's not only depending on the machine. You also have to think what's going on. So but Baxter's always there to help at the same time the nurse.
Baxter's the
So,
company that makes the machine, right? So they
yes,
can
yes,
support,
yes.
yeah.
You can call them at 24 hours at any time of the day. For
Yeah.
example, if you have problem, because usually the nurse will tell you if it is not medical, like you don't feel anything wrong with you, and it's the machine that is having difficulty, then you call Baxter. So I call Baxter and tell them that the machine is like this, and they can fix it on air. So they will tell you do this, do that, and then if not, then they will say, okay, turn it off. And then there was time that really it was not functioning well, and they said, okay, you have to, get off the machine, and then tomorrow you will change it. So there are times when I do that. So, but the nurse will also follow up with you. So they change the machine because it's not functioning well. So you really have to check also on that. Also, I don't really sleep 9 hours. There are times when I check if I drain well, and then if in the middle, because there are four exchanges, so there are 4 drains. So the first drain, you know that because there's an initial, you see that. And the second drain, sometimes I'm not yet asleep, I can feel it, so I will check if it is draining well. So, but after that, sometimes, you doze off and you sleep. But usually when the first 2 is good, all throughout it will be good.
Well, I just want to say a huge thanks to all 3 of you for joining us and for sharing your experience. I don't think I can explain to you how valuable this is to us and to our resident doctors, the opportunity to hear from you and your experience. So thank you for sharing your time with us and your wisdom. We really appreciate it.
Oh,
and I'm sure everyone is applauding. Yeah.
One thing I'd like to add, some hospitals are not, I don't know, not so familiar with peritoneal dialysis, because I was hospitalized not for kidney last September because of heart problem. So I had a blockage or something like that. I didn't feel well, so I called 911. And when I was in the hospital, in the ER, I told them, oh, by this time I need to do my dialysis. And they said, oh, you're good, you're good. They always say you're good. They're checking on my heart. But I said, no, I need to do my dialysis at 8:30. And then I was already 9:30, 10:30. And they were still doing laboratory for my heart, but they didn't do anything for my, and then they said, when you're already in the room, that's the time you're going to do the dialysis. It took me like 1 day before they said, oh, you're still okay, you're still okay. So, that I was really worried, because they said, okay, and then they have to call somebody from kidney to do the dialysis. So
Yeah,
that's one thing. I think I had that twice. Not only one hospital. So I will mention the name of the hospital, Swedish, and then I went to Virginia Mason. It's the same thing. They have to call kidney center. So
well,
I don't know.
that's a really helpful perspective. And I want to say that, just being here and sharing your time with us is helping to educate all of these doctors, so that more people in every hospital can be familiar with it. So thank you so much. I really appreciate you spending your time with us. You're more than welcome to hang out and listen to our next speaker, but you don't have to. I'm sure you have other things to do. So thank you again. And I'm going to turn it over to Dr. Sanghavi.
Great.
Thank you very much.
Thank you.
Yeah, I just wanted to thank you all again. It was a really nice segue. So I'm going to thank Carrie for asking that last question. Oh, am I on mute? No. Okay.